My name is Agam Dewan. I'm a board certified psychiatrist, and I've helped over 200 PMHNPs gain clinical confidence in their psychiatric diagnosis skills, treatment skills, and getting over imposter syndrome to actually help their patients get better. And so in this video, we're going to be covering intermittent fasting. So I've had some patients who've asked me about this because what I'm noticing is over the past 5 years, there's been a trend towards more integrative psychiatry. People just don't want medication management anymore. They want lifestyle changes and supplements and holistic interventions to help out their mental health. And so, as practitioners, especially if we want to be relevant and we want to do the best for our patients, and quite frankly, if we want to make more money in our private practice, then we have to understand integrative psychiatry. And so understanding intermittent fasting, I think, is an important aspect of that because this is something that we can recommend to a lot of our patients because it has such great benefits. It's something that I practice every single day. I'll fast at least 16 hours, 16 to 24 hours, depending on the day and what I have coming up. But great vehicle for body composition, for weight changes, and mental health benefits. So I'll explain those. So what exactly is intermittent fasting? All intermittent fasting means is that you're fasting intermittently. So it doesn't mean you're fasting continuously. It means you're fasting in intervals. So the standard protocol that's the most common is called the 16-8. And all that 16-8 means is that 16 hours fasted and 8 hours eating. And all it means is you divide your windows. Your 24 hours a day into these windows. So for example, standard is, okay, you start eating at noon, you might have a lunch, and then you might have a snack around 4, and then you might have dinner at 6, and then, that's it. So that within that 8-hour window, then you stop any kind of eating at 8 p.m. And then from 8 p.m. that day till 12 p.m. the next day, you skip breakfast. That's your 16 hours of fasting. So that's one protocol. Another one is, you can extend it how you want. You can go 24, 22, 2. The whole point is basically you're extending your fasting window and you're shortening your eating window. So if your eating window is shorter, then you're going to eat less. That's the theory behind it. So I personally, the one that I do is called OMAD. So this is more like a 23 and 1. So it's one meal a day. So one meal a day, which I do. I personally just like eating a lot, getting all my calories in, and then being done. I don't do this, of course, every single day, especially if I have a social occasion coming up. So for example, tonight I have a friend's party coming up. So I'm sure I will be consuming calories at this party. So I had about half my daily calories in the morning or today, and then I'll have the other half for the nighttime. But on a general normal day, that's what I do. But I've done all of these protocols, and there's also other ones that exist too. So there's alternate day fasting, where you might fast for, or you might eat for one day, then you fast the next day, then you eat the one day, then you fast the next day. So that's a protocol. Then there's also 5-2, where you eat for 5 days and then you fast for 2 days. So 5 days eat, 2 days fast. Basically, they're all a variety of different methods to accomplish the same thing, which is to get our body in a fasted state. Now, why would we want to get in a fasted state? In a fasted state, this is when our body burns fat. So in a fasted state, what happens is that we need glucose for our daily sustained activities. And so glucose comes from our food, but it also comes from the stored glycogen in the liver. And glycogen stores last roughly 16 to 24 hours-ish. And so when the glycogen stores start coming down, but we still need glucose for our daily energy functions, and the body's like, oh crap, we need to find more glucose. So then it starts looking at the fat reserves of the body to break down to get the energy, to get the glucose. So when you fast, it helps to accelerate that process. Now, that's the theory behind it. So now studies have shown that whether people intermittent fast or whether they don't, as long as they burn this, or as long as they eat the same amount of calories, they still lose the same amount of fat. So overall, it evens out. But theory wise, that makes sense. And I think the benefit of fasting is the time restriction of eating. And so that time restriction can really help to limit calorie intake as opposed to when you are able to eat freely. But overall, it's an effective vehicle for burning fat. So it helps push towards ketosis, especially the longer that you do the fast, the more it will push towards ketosis. I mean, that's one benefit, but psychiatrically wise, like why would we advise our psych patients to do this? One of the biggest reasons is that it decreases inflammation. And so inflammatory responses are thought to be one of the hallmarks or the reasons why psychiatric illness exists. So by reducing inflammation, we can really help our patients with their psychiatric illness. So depression, anxiety, bipolar, ADHD especially, all correlated with inflammation. And fasting has been shown to reduce inflammation. And one of the big mechanisms it does this is it increases autophagy. And what is autophagy? And basically, all autophagy is decrease of bad cells, increase in new cells, or cell turnover. So our cells constantly are dying and being generated, dying and regenerated. This is a constant cycle that's happening. And so inflammatory cells, damaged cells, these kind of cells, they're the ones that cause cancer. And so, but the bad cells can also cause damage as well. They can contribute to inflammation. And so, in the brain, if you have inflammation, you have bad cells, you have damage that's going on, then that causes oxidative damage to the brain. And any kind of brain damage, of course, even minor damage, like microvascular damage, causes brain issues because the brain is a physical organ. And so, damage that's occurring to that is going to manifest in mental health issues. So with autophagy, you help just clear out, detox your body from toxins, damage, et cetera, et cetera. That's another benefit of it as well. So biologically. And then speaking of brain, something else that it does is increases brain-derived neurotrophic factor. So basically this helps to increase brain cells, neuron growth. So my hypothesis is that all this is linked. So when you have increased BDNF, because now you have increased cell turnover, so the cells need to turn over, so new cells need to generate, so that makes BDNF. And so BDNF is associated with increased cognitive abilities. So if you have increased cognition, then of course things are going to be better for you. And then the autophagy occurs because of the inflammation that's happening that it needs to counter. So all this stuff is interlinked. Another benefit, I mean, this is more body related, but decreasing insulin resistance. So we know that diabetes is correlated with mental health problems. So if you can decrease your insulin resistance, you decrease your risk of diabetes, and then thus you decrease your risk of mental health conditions. And the reason it decreases insulin resistance is pretty simple. It's that instead of insulin hitting the system, the receptors again and again, it hits it much less because you're eating less. So it gets a chance to break and it gets a chance to desensitize. And for example, for me, I've never had diabetes. I know I'm never going to have diabetes despite my grandfather having diabetes and losing his leg to amputation is because, I do fasting. And so, no matter if I eat like chocolate cake or sugar or whatever for a birthday, like I know it's not going to cause me diabetes because my insulin receptors or my insulin is very, very sensitive. It hasn't been desensitized at all because of the fasting. So there is that. And then, yeah, so these are some of the main benefits of intermittent fasting, especially for our mental health patients. So I highly, highly recommend it to offer it. But so how do you get into this? Well, there's a bit of an adjustment period. So especially when you start to feel like ketosis, people can kind of feel weird. They can kind of feel foggy. They feel, oh, something I forgot. One of the benefits of that too is increased mental health clarity. Increased mental clarity. So A lot of people say when they feel fasted, like that's when they feel like very sharp and clear. And I feel this way too, especially if I wake up in the morning and I've been fasted, then I tend to feel very sharp. And, all this stuff relates because of the increased cognition from the increased BDNF. But the clarity is a very important piece. But anyway, so there's an adjustment period. Ketosis takes some time to adjust, but so even it just takes like a week or two. But once you're able to get over that, then it becomes a pretty natural way of eating. Just so for me now, eating breakfast is weird. Like my hunger levels are very well regulated to the intermittent fasting cycle. So if I like, I'm doing some social thing or like, I'm with family and they want to have breakfast or we're at dinner for someone's or, we go out, stay with some friends, whatever, then they want to have breakfast. And it feels weird for me to eat breakfast because I'm so used to this fasting method. But yeah, I hope that this helps you understand just the fundamentals and the basics of intermittent fasting and how we can utilize this as healthcare providers for our patients. And so if you want to learn more real world psychiatry, more integrative psychiatry, stuff that you probably didn't learn in PMHNP school, or you might feel like you're struggling with real life patients, or you want to be able to help out your patients more, then I would recommend joining our coaching program for PMHNPs and FNPs, Level Up Psych Academy. We've had over 200 students go through so far, and they're getting a ton of value from it and really learning a lot. So yeah, hope that this has been helpful, and I'll see you in the next video.